For many people with incurable or life-shortening illnesses, palliative and end-of-life care helps provide support and reassurance at a difficult time. It can be provided in hospitals and hospices, in community settings and people's homes. Recently, at both a strategic and policy level, there's been a focus on improving access to palliative and end-of-life care. At community level, there's been a move towards encouraging people to have conversations about death and dying and to think about end-of-life care wishes and planning. This type of care is provided by a range of healthcare professionals, including nurses, doctors, physiotherapists, occupational therapists, psychologists and psychotherapists, counsellors, family support, and social workers. Other people can be involved too, from family members, friends, partners and spouses, to children, other community members and organisations. Good palliative care happens when each of these people work together to provide the care and support the dying person needs. But for people with experience of mental illness, this is still not the case. Their needs have not been well understood, and care is difficult to access, partly because of the fear that stems from the stigma surrounding both mental illness and talking about death and dying. This research found that care providers don't work in a joined-up way and often feel unsure about their roles. Both mental health and palliative care staff said they often don't feel confident when working with people with mental illnesses who are approaching the end of their lives. This leaves people feeling confused, vulnerable and alone. Just at the time when people most need support, services are stepping back. Healthcare staff said they felt worried about discussing death with people with mental illnesses, about upsetting the person or making their mental health worse. Palliative care staff said they wanted to know more about the mental health system and how different conditions affect people to help them provide better care. Mental health staff said they wanted to know more about palliative care services and how to help people plan their care. Feeling unsure can make staff seem hesitant and avoidant, and patients said this feels like professionals are treading on eggshells. The lack of understanding of roles and services means that healthcare providers often don't work together to provide the palliative care that people with mental illnesses and incurable conditions need. Patients and carers say they feel ignored or excluded from conversations about end-of-life care.
I'm treated differently because of my mental ill health.
I hide my mental illness. People think I'm dangerous if I say I have psychosis, so I just say I have a bit of depression.
Professionals seem to have no understanding of how hard it is to have mental health problems and a life-limiting illness. They don't talk to each other or me about my care.
I've had professionals avoid having conversations with me, like they think I'm too fragile.
I feel abandoned by mental health services.
My carers and family are ignored by professionals.
As a carer, I'm often ignored or excluded from discussions while at the same time being expected to be the expert.
I just needed them to lean in. When I most needed them to lean in, they stepped back.
So, what can we do to make this better?
See me as an individual.
Talk to me and talk to each other.
Don't exclude me. Help me plan.
Don't be scared to ask me or tell me about my care.
Talk to the people I care about, although I might not have close family and friends.
I might need more time or more support than someone without a mental illness.
Small changes can make really big differences to patients with mental health issues. So please, lean in. Don't step back.